has got a lot of exudate. So it's really been draining a lot, especially because it had all that slough in there that we've been debriding, and it's got a lot going on. So what we're going to do, probably have the patient on their side, which will be better, because if they're not, most patients aren't laying on their stomach, but if they are and we spray this in there, it's just going to sit in there. Now, a wound that's deep like this, you have this tunneling, you have all this undermining. So if the undermining was on the side, you want to be, when you're spraying this in, you don't want that just sitting there. So you want to try and make sure you're spraying it toward a side that it can actually drain out of, if possible. So, and that's where you were saying, depending on, how much are you going to use? If you have like a smaller one of these, this is going to be fine. But for this wound, you're going to be spraying a lot of these in there. And these are not cheap. So, somebody was telling me that actually it's better to buy the big things of saline. It's cheaper than buying these little bullets. So some facilities, I know, they just want you to just pull it up in here. Or like I said, even the little ones that the nurses use for IVs. Yeah, those could even be used. So.
But we have the one in a bottle this size, and I just take the solution from there.
Yeah. So we're gonna fill our syringe with saline. We're gonna clean it out as best we can. It's not doesn't mean we can't still use the gauze to try and like pad if we need to, but we're trying to make sure that we get that pressure in there a little bit to get any bacteria off.
It doesn't have to be the sterile one.
No, just any gauze. Yeah, because this is just clean. None of this is
technique only.
Yeah. I mean, it'd be great if we could use sterile technique, but.
Well, because I'm more like, because we have all this sterile one, so I open the other one, I open them up, and then this one I use it just around, and I don't use it directly on the wound.
Right.
I use the sterile one.
Yeah, I mean, you probably don't want to like be rubbing all over, especially if he just had a bowel movement and then be rubbing in there. You're just going to be moving all that normal flora into the wound, and that could create an infection. So you don't want to do that. If you have any of those pads, you can put them there, or the chucks, or I've even seen the gray containers that patients use to brush their teeth in. I've seen people put them under there to collect it so that that doesn't get that wet. So kind of whatever works for you. You got to figure out your own process based on what you have. So once we've cleaned that wound, what we're going to do is we're going to want to pack it with the alginate. So the idea behind that is that's going to absorb all of that exudate that's in there. So
so the alginate first, and then you pack it with another wet gauze.
Yeah, depending upon,
you need to fill up that space, right?
Right, and you don't need to fill this entire thing with alginate. If depends upon how much drainage. If you come back, if you do this dressing and you pack it full of alginate, and you come back the next day and the bottom one is turned to that gel, but all the rest isn't, then you might need the alginate, but maybe not that much. So you kind of base it off of what you're pulling off and kind of what you're seeing. But it doesn't matter.